Get gastric bypass surgery in your mind and start to melt off the pounds. Have our writers gone insane? Or can lap band hypnosis be a real option for you? I'm Kimberly Walton with Spotlight Focus next on Insiders Health News. Think yourself down a few sizes. It's as simple as that. Okay, there's more that goes into it, but for a growing number of people, lap band hypnosis is working wonders. The idea is that a licensed psychologist and hypnotherapist will implant suggestions into your mind, making you believe that your stomach has actually gotten smaller. Even though there are no stitches or side effects, the mind takes over and makes you believe that you need smaller portions to get full. The actual lap band surgery is one of the most successful programs for short-term and long-term weight loss. It does, however, come with a whole set of problems and side effects that can be life-threatening. But if you just imagine a smaller stomach, imagine smaller portions filling you up, it seems you can get most of the pros without any of the cons. But many doctors, of course, remain skeptical. But for patients across the Northeast and the country, gastric bypass hypnotism is proving to do what fad diets and workout programs couldn't. As for our take, we're smart enough to realize that our minds can do some pretty amazing things. And if people are losing weight in a healthy way because of a few sessions with a psychologist, we're ready to embrace a little magic. In lighter news, Hollywood HealthBeat host Kim Lockett will tell us how Jewel is reducing her risk of breast cancer with the help of a man. That's coming right up.
Thanks. I'm Kim Lockett, and this is Hollywood HealthBeat, your lifeline to the hottest health happenings in Tinseltown. Today, we're checking in with new mom Jewel, who is reducing her risk of breast cancer simply by breastfeeding her 7-month-old son, Case. In a celebrity interview with Celebrity Baby Scoop, the singer said that her motivation for breastfeeding is both nutrition and the fact that, quote, breast cancer decreases almost 70% for 1 year of breastfeeding, and it can go up to almost 90% for 2 years of breastfeeding, end quote. We checked Jewel's facts, and while these statistics are not proven, there is a strong link between breastfeeding and breast cancer reduction. According to a 2010 study published in the Archives of Internal Medicine, women with a family history of breast cancer were 59% less likely to develop breast cancer if they breastfed their children. While researchers are not sure why this connection exists, they suspect that the lactation decreases inflammation in the breast tissue that might encourage the growth of breast cancer cells. Want more benefits? Babies who are breastfed during their first year may be less likely to develop ear infections, allergies, diarrhea, eczema, bacterial meningitis, and other serious illnesses. And women who breastfed at least 24 months have a 23% decreased risk of developing coronary heart disease. Does 24 months seem like a long time? Jewel thinks so too, and says she will probably only breastfeed baby Case for a solid 12. She does point out that the World Health Organization recommends supplemented breastfeeding for 2 years or more, but the American Academy of Pediatrics says 1 year is still sufficient. Even if the stats are shaky, there's no denying the wonderful benefits of breastfeeding should your body let you. It's your decision, but we commend Jewel for doing her research when it comes to her little gem. Until next time, I'm Kim Lockett for Hollywood HealthBeat, and I always have my finger to the pulse of Hollywood.
Little gem, Jewel, I get it. Nice one, Kim. That's it for this edition of Insiders Health News, but we'll see you right here next time.